Good evening. I'm Frank Quinn and I'm joined by Dr. Jeffrey Persson this evening. Welcome to our webinar on vasectomy reversals. As you may or may not be aware, there's probably about 25,000 men each year that have vasectomies, and probably about 3% of those at some stage may consider having a reversal. So what we'd like to do is to chat to you tonight about vasectomy reversals, what it entails, the risks, success rate, and basically answer any questions that you may have. Basically, the proceedings for tonight is Jeffrey will run through a presentation for you on vasectomy reversals, and then at the end, if you've got any questions, we're more than happy to address those questions.
Hi there. Look, as Frank has outlined, I'm going to talk about vasectomy reversal, and we work as a team together. In fact, we've been in this job for about 2 decades, so we've got a lot of experience. And vasectomy reversal, or this sort of work, is part of what we do. And I think one of the good skills that we do have is that we're not just involved with doing surgery. We see couples together and we see what particular problems exist, and we have a few ways of approaching things which make the way we look after this particular aspect not necessarily unique, but I think quite efficient for couples. Okay, because every couple comes along with some unique baggage. It's not just an issue of whether a guy has had a vasectomy at some stage in their life. There's other issues that you really need to consider. You need to consider the age of the female, whether they've got any other medical illnesses, whether they've got some gynecological issues that may be important, things like endometriosis. So there are significant factors that can affect ultimately the success of the procedure, and therefore the choice of whether you should be having a reversal. And there are, of course, significant alternatives to reversal. IVF has been around for a long period of time, and the process of testicular sperm retrieval from the testis, utilising a process called intracytoplasmic sperm injection, has been available for 20 years. And for quite a significant number of couples, that will be an appropriate choice and a better choice than vasectomy reversal. But probably about 2/3 of the couples that we see who, as their first intention, might have vasectomy in mind, ultimately that is probably their appropriate choice. But you need to sort out whether it is a good idea to do this or not. Now, some of the things that might be affecting the chance of success are whether there could be the presence of sperm antibodies. Now, sperm antibodies exist because sperm themselves are cells that weren't created at birth. They haven't developed until puberty, and they have unique proteins on the surface of the cells which can invoke an immune response. And women will sometimes have sperm antibodies, but men in particular after vasectomy, a significant number of those will have high levels of sperm antibodies, which you may see in the blood, but more importantly, even in the seminal plasma. Even though there's a blockage there, if you measure in the seminal plasma these entities called sperm antibodies, if there are high amounts of these will frustrate the processes of normal fertilisation after vasectomy reversal. So there might be quite a successful sperm flow, but it won't necessarily work. So if we screen those candidates out who've got high levels of sperm antibodies, they are much better off going down the pathway of using IVF. Now,
and Jeffrey, can I just ask you, what is a vasectomy reversal? What does it actually entail? Could you just sort of run through the procedure for us a little bit?
Well, typically it's microsurgery that involves basically undoing the blockage which has been placed now in the scrotum. Now, most guys have had their vasectomy done under local anaesthetic, but sometimes it's done under general anaesthetic. And in my experience, sometimes under general anaesthesia, the process of division of the vas deferens and potentially the damage that's occurred might be more extensive than one would see under local anaesthetic. So that's an important issue when you're trying to figure out the prognosis for success. Was this carried under general anaesthesia or local anaesthetic? In my experience, under local anaesthetic, generally it's much easier to reconnect the tubes themselves. So what you do is you divide this area. So you cut upstream and downstream from where the blockage is, and you then explore downstream to make sure that that pipe is still patent. We squirt basically some salt water down there, and then we massage the pipe upstream of where the cut was, down from the testis down, to make sure that there is some sperm coming through. And that's really important. We intraoperatively, because we do this in our day surgery, which is associated with our IVF unit, we grab one of our scientists from the laboratory, one of the sperm scientists, and we make sure that we can find sperm upstream. Otherwise, there's no point in reconnecting at that particular site. It could be that there are secondary blockages which exist further upstream in part of the testis called the epididymis, and if you don't identify that, you're possibly missing the chance of carrying out the correct operation, which is sometimes a bypass operation where we put the vas deferens directly onto the epididymis, and that's called a vasoepididymostomy. And there's definitely a place for doing that where there are distal blockages in the epididymis. So that's the reason why it's really important this is carried out with intraoperative sampling of the sperm coming from the upstream blockage. Okay, now you need a general anaesthetic. This is an operation that does take a fair bit of time. It'll take an hour or two for us working as a team to do this with microsurgery, so you can't be awake whilst this is being done. You'll need to allow at least a week of convalescence at home. It's really important. The post-operative recovery is just as important as what we do intraoperative, because if you disrupt these extremely fine stitches, which are the size of human hairs, they're very, very fine. That's a shame, because you'll wreck your chances of achieving a good anastomosis. In general, you can expect a chance of pregnancy after probably 2 weeks, and we would advise getting a semen analysis 1 or 2 months after the procedure. And you'll generally know immediately whether this has been successful or not. And if you pick your cases appropriately, you should expect probably 90% of couples to have a good chance of success.
Now, Jeffrey, just with regards to sort of reversal success, you know, people sometimes talk about patency and pregnancy. So I was just wondering if you could perhaps explain those two different aspects between reversal success.
Well, patency merely means that you can find sperm coming down through the pipe, but that sperm, for some reason or other, may not be fertile. It could be that the numbers of sperm are lower than you'd normally expect. It could be that the motility is diminished. It could be that the sperm shape is not ideal. And any one of those factors, or in combination, will affect the chances of natural conception. And unfortunately, some guys, even if they didn't have sperm antibodies detected before the procedure, they might have sperm antibodies found after the procedure which are interfering with the processes of natural fertilization. So it's not just a question of patency, it's whether these sperm have a good prognosis for success, which is why if you do actually have a sperm test after your operation, it should be done at a good laboratory which basically has the methods for detecting whether these issues are available.
And you alluded to earlier on about the male and the female factors. I was just wondering perhaps if you could summarise with regards to some of the important male and female factors that may contribute to the success or not the success of someone considering having a vasectomy reversal.
Well, it's really appropriate to figure out whether the female contribution to the chances of success is likely to be gravely diminished. Women who are probably over the age of 43 have very little chance of success after this procedure. Unfortunately, the quality of their eggs, even though they might be ovulating regularly for the next 10 years in their life, is such that it's unlikely that they will achieve a pregnancy. So you need to give people good factual advice about the prognosis. So if women are younger than that, and typically in their mid to early 30s, and they have a good egg reserve, which we can now measure by a test called anti-Müllerian hormone, then they do have a very good chance of success. But you should also identify whether they've had any particular grave insults in their pelvis, such as endometriosis, whether they might have had a history of tubal disease, and you should be sorting out whether there could be a problem with tubal blockage. Any one of these factors might adversely affect the chance of natural conception, but on the other hand, they might still have a good chance of alternatively using IVF with intracytoplasmic sperm injection to achieve pregnancy.
And Obviously, the vasectomy reversal is, something worth considering, but there is that alternative of perhaps considering, IVF and ICSI. I'm just wondering if you might be able to just explain to us, if someone's not suitable or doesn't want to do a vasectomy reversal, what actually is entailed with an ICSI procedure.
Okay. Well, before you even get to the point of ICSI, IVF involves routinely the administration of about 10 days of medications which allow us to get a multiplier effect. The normal human processes of ovulation lead to just one egg being released. But if we use controlled ovarian hyperstimulation, we can usually get 9 or 10 eggs, which gives a multiplier effect to the whole chances of success. And IVF routinely involves just mixing eggs and sperm, about 50,000 sperm in a tiny little petri dish. And unfortunately, if there is a problem with low numbers of sperm, or if there's sperm antibodies, you then have difficulty in achieving a pregnancy with that approach. And 20 years ago, there was some guys in Brussels developed a unique process of injecting with an extremely fine needle a single sperm into the egg. And that radically changed the whole processes of treating factors of fertilization. And we would typically use this in many couples where they might be unsuitable for vasectomy reversal. We've also got a few other techniques that we use with this. We've got a process called digital high magnification now, which enables us to better select sperm in guys who might have a subnormal sperm profile, as measured by some elements within the sperm cell called vacuoles, high levels of vacuolization. If you don't discriminate using the routine ICSI processes, you'll achieve potentially poorer outcomes, but using digital high magnification, we can select the best possible sperm for this process.
Right. And just obviously there's a vasectomy reversal in the IVF, and all procedures, I guess, have got complications. I know sort of complications are quite rare with vasectomy reversals, but perhaps you might be able to explain to us what risks there may be if someone's considering having a reversal, as distinct from perhaps if a couple are considering to do IVF, what risks may be involved with that sort of treatment.
Well, I don't think there's any risk to life and limb from the procedure. Okay, it's a relatively safe procedure, but there are some potential common complications with any operation where we cut the human skin. There's a risk of infection, so that does take place. But fortunately, if that does occur, it's usually just an infection in the upper layer of the skin, and that resolves generally quite quickly. Occasionally, there might be a hematoma, and in very rare cases, that might need to be evacuated, but that's relatively uncommon. In most instances, guys just get some swelling, they get some pain, but in many instances, they've told me that they've had less pain from the vasectomy reversal than they might have initially had from their vasectomy. So for many men, it's a very well tolerated procedure, but the main thing they've got to do is take it easy for the first week, so they'll get less complications with things like bruising, swelling, soreness, and more importantly, they'll actually get a better result. There's a better chance that they won't disrupt the tiny little stitches, which are the only things that are holding the vas deferens together before proper healing has taken place. There's no real healing for about the first 6 or 7 days. It's beyond that you start to get normal tissue reformation and healing. So they do need to take it easy for the first couple of weeks, and particularly the first week after the operation.
And also risks with IVF. What sort of risks if people are considering IVF?
Well, again, it's an extremely safe procedure, and it's extraordinarily rare that women are permanently harmed by this process. In fact, in Australia, the risk of dying from the procedure is probably about 1 in a million. There'd be almost no medical procedure which is as safe as this. There are some common complications, a condition called hyperstimulation, which might affect roughly 1 in 200 women, but the approaches to the management of this have improved dramatically in the last few years, and I think that it's really quite uncommon for most women to have much more than some pelvic discomfort from the processes of egg collection for a day, And beyond that, they might feel some bloating, they might be tired, and it is annoying having to give some injections for 10 days, but it's something that 9 out of 10 couples, after they've done it, realise it actually went, without too much in the way of difficulties.
I mean, often a common question, obviously in these sort of procedures, because they take a couple of hours and entail a general anaesthetic, involves the costs. So could you give us, our audience, a bit of an idea of what the costs may be?
Well, we're fairly lucky in Australia. If you have Medicare coverage, a large part of your IVF and a large part of potentially of your vasectomy reversal procedures are covered by the processes of Medicare. As well, if you've got private health insurance, that covers a component as well of the day facility care that's involved with either one of these approaches, either IVF or vasectomy reversal. In general, if you're talking about a one-off procedure, the out-of-pocket costs of vasectomy reversal are probably lower than IVF. If you're looking at the issue of IVF, there might be some recurrent costs, which could be higher, such as having repeated embryo transfers. That adds an extra layer of cost to the process. So in the first instance, for many couples, vasectomy reversal makes sense financially. And
obviously, with vasectomy reversals, there are different types of doctors that do the procedure, commonly urologists and fertility specialists. And have you got any thoughts as to sort of, what you would do with regards to choosing a surgeon?
Look, I think in any case, it doesn't matter who you see, they really should be someone who's experienced at this and has got the right level of appropriate training. And the benefit of seeing, in particular, a fertility specialist is that they can weigh up appropriately both partners and the likelihood and the prognosis of success with the contribution that they both bring to the party. And a fertility specialist, in many instances, has got more skills with respect to the female processes and can outline the alternatives of IVF the best.
Right. So if I could just, I guess, summarise what you've said this evening, a couple of points that may affect the success is basically how long it's been since the vasectomy.
That's relative. I don't think that's an absolute one. I don't think there are any absolute rules with regard to that. I've had successful cases where the vasectomy's been done 20 years before. In fact, we've even done redo operations. So that per se isn't the issue. I think the main issue is, in many cases where there might have been a long time since a vasectomy, it could be that their partner is now much older, and that's affecting the odds of conception too. So this is why you really need to look at the age of the woman. And as far as the second question there about the total financial cost for both, I think we've covered that to some degree, but they'll be determined, I think, by the level of private health insurance of couples. And clearly, I suppose, in some couples, they might be planning to just have one child after this procedure. If they're pretending to have more than one child, then maybe vasectomy reversal is more efficient for some couples. If they're thinking, well, gee, we'll just have one child, then maybe just one IVF process for many couples might be a simpler procedure, particularly if there are any other issues that affect the prognosis in the female.
Okay. So just a little bit of housekeeping. If you're joining us this evening for our webinar, if you're on Google Handouts, you'll see a grid of squares on the top right of the Hangout window. And if you click on that and the Q&A button, that'll open up the questions window down the right-hand side. And at the bottom of the questions window, you can click on Ask a New Question. And we'd love to hear from you for any questions you may have pertaining to vasectomy reversals. If you are streaming with us live on YouTube, you can submit your questions below the video in the comments section and type your question in there and then click on the post. So at this stage, if you do have any questions, we'd love to hear from you and answer those questions. In the interim, if you are interested in vasectomy reversals, obviously you can contact Dr. Persson directly at IVFAustralia on the rooms 1800 111 483, or alternatively at his Greenwich rooms on 02 9425 1600. So at this stage, we might take a few questions.
By the way, Frank and I work together as a team. In fact, this Friday we'll be doing an operation like we normally do together. We'll be. It's great to have two sets of eyes, two sets of hands doing this work.
One of the questions was, when do you get a sperm test to know it's successful after the vasectomy reversal?
Look, I think I'd probably wait 4 weeks till people are comfortable to do this procedure, but waiting any longer than that doesn't really have much sense. There will be immediate sperm flow through these pipes, providing the anastomosis is in place.
And another question came through is, what's the chance of success with IVF if someone's already attempted a vasectomy reversal?
Well, there shouldn't be any reduction in the chances of IVF success after vasectomy reversal. In fact, if there is a problem with the sperm, by virtue of problems like sperm antibodies or low numbers of sperm, you should still be able to use that sperm, which is available in the ejaculated semen, very efficiently with an IVF procedure. And in that circumstance, it's unlikely the couple would need an additional procedure such as testicle biopsy to retrieve sperm.
Right. And another question came through, Jeff, just on how long after the vasectomy reversal can the couple commence trying to conceive?
Well, I've seen people getting pregnant first go after just 2 weeks. So I think 2 weeks is probably the minimum. There's no maximum, but probably the minimum to make sure that there's no problems with the healing. And
obviously, if someone's had a vasectomy, there has been, I guess, old sperm built up into the testicles for maybe, years, a couple of years after that procedure. Is there any problems with potentially conceiving with that sperm that's sort of sitting there?
Well, I think to be honest, I think it's a bit of an old wives' tale. I think that any sperm that comes through and is capable of efficiently finding its way to an egg is perfectly vital, and there's really no problem. So I don't think you need to wait months just to get some sort of perky super sperm. There's really no evidence of that.
And presumably, I guess that after someone has a vasectomy reversal, you may find improvement in the sperm parameters over a period of time.
I think that's possible, but in general, their first semen analysis will give you a good idea of the prognosis. But yeah, if it seems disappointing, the first result, you probably get another test within a couple of months. But I think that if hasn't been a return to normal numbers of sperm, speed of the sperm, shape of the sperm within 2 or 3 months, it's unlikely that it will be there'll be further improvement.
Right. And there's another question here about the initial cost for an appointment with a fertility specialist. I mean, I can answer that. Generally, it's about $300. You get about $120 back from Medicare. It's recommended that you get a referral from your GP so you can claim the Medicare rebate. And oftentimes that consultation will take somewhere from 40 minutes to an hour because the fertility specialist, like Jeff and myself, will take a history from both the male and the female, because obviously both parties are important to give you the best advice as to the best way moving forward.
And examine the girl.
Okay. Well, thanks for joining us tonight. If you've got any other questions, please don't hesitate to contact Jeff and myself, but we appreciate your attention, and good luck in your endeavours moving forward.
Yes, I trust that's been helpful.